Hi everyone, good evening, and thank you for joining us for another Talks with Tyner. Sorry we're a bit late getting to you. We had some technical difficulties, but let's jump right in. My name is Sarah. I'm the Director of Community Relations here at Primary Bodyworks, and I will be the moderator for tonight's seminar. We are joined by Dr. Michael Tyner, our Chief Medical Officer at Primary Bodyworks, and we have a very special guest with us tonight, Dr. Joe Ritten, DPT owner at Physical Therapy to You, and that's located right here in Cary. Tonight we will be discussing stress and how it can negatively affect the body, but specifically myofascial pain. And did you guys know that April is actually Stress Awareness Month?
We do now, but that's why we picked this, so we try to be on top of it all.
Right. To start us off, Dr. Tyner is going to give a brief overview on stress-related myofascial pain, and then Dr. Joe will be discussing posturing and some tips and tricks to improve it. And I've actually started using some of those tips every day.
That's great.
Finally, Dr. Tyner is going to discuss how Primary Bodyworks' proven proprietary treatment can help you when you're experiencing myofascial pain related to stress. And at the end, of course, we're going to have the questions and answers segment, but feel free to write in at any time with your questions. So with that out of the way, let's talk stress.
All right. So previously, and you didn't hear it, sorry about that, I got started on the issues of myofascial pain, and then we're back into how stress response exacerbates what we call myofascial pain. And myofascial terminology for us relates to the muscles and the connective tissue that is associated with muscles, which eventually lead to connections to the bone. So it's muscle, fascial, connective tissue pain. And in a standard environment, in a muscle that's overstimulated, overused, abused might be a better word. What goes on in those muscles, development of what we call triggers or tight areas, spastic areas within the muscle bed. And it can be somewhere in the middle of the muscle or as the muscles approach the bones to which they're attached. And if you were to look, say at a microscopic level, what's going on is that the muscle's in a constant state of contraction in those areas. There's going on inside the muscle cell, a persistence of calcium in the muscle tissue, and that's what leads to the actual contraction of the muscle. What's going on around that is that the blood flow to that area of the muscle is limited, because as the muscle contracts, it actually squeezes the blood vessels around there, and it inhibits its own blood flow, which ultimately is what you need to reverse contraction. In addition to that, the absence of oxygen, and also an inflammatory environment, can develop fairly quickly, and with that, the pain receptors then get stimulated. And obviously that's what we're relating to here, is the pain that goes on in that process. In terms of stress, stress is associated with one of the parts of the nervous system. We call it the autonomic nervous system. And what that means is it happens automatically. You don't necessarily have control over what's going on. That's very different than if you want to tell yourself, as I was saying earlier, to pick up a cup of coffee. You reach your arm out, but you're basically telling yourself to pick that coffee up. Your muscles are regulating themselves so they don't spill it on you. But that's very different than if you're frightened or under persistent stress of one sort or another. That's when the autonomic nervous system comes into play, and there's a part of that called the sympathetic nervous system. And those are nerves that are associated with stimulation to help protect you. So if there was a bear coming out of the woods, and I'll tell you, my son was hiking in Colorado last year, and he saw two green eyes looking at him. It was about 5:30 in the morning. He wanted to go see the the sunrise over the top of a mountain, and he was looking up the trail, and there were two green eyes looking at him, and he turned and went the other way, and he sprained his ankle doing it, but whatever it was did not get him. And he did that almost instinctually, and that's part of this fight or flight complex that our bodies are prepared for. and the sympathetic nervous system sort of preps you very quickly for how to deal with a circumstance like that. And as it turns out, the sympathetic nervous system augments what's going on in these muscles that you're asking to work, and it causes an increase in the neural signals to tell the muscle to fire, and it causes a persistence of calcium persisting in the muscle cell, which basically keeps the muscle from relaxing. So the sympathetic nervous system stress kind of exacerbates how a muscle functions, and it can cause it to stay in a persistent state of contraction. And from there, then you get into a state of persistent irritation of nerves and therefore pain. So kind of long-winded, but stress comes into play. And as it turns out, what we see is that there are certain muscle groups that are much more vulnerable to this sort of stress environment. And sort of personal story, I was an intern, had gotten married to somebody that hadn't actually been around for several years because she was busy trying to learn how to be a dentist while I was busy trying to learn how to be a doctor. We were 6 hours apart. Her mother hated me, which didn't help, and finished all that, and I became an intern. And I was working about 120 hours a week, and I was married to someone that had been around for a while, and somewhere in that process I started grinding my teeth, and I woke up one morning with this horrible headache and I couldn't open my jaw, and I ultimately had surgery for that. But what I didn't know at the time was that stress had really just piled up on me, and I was busy trying to be brave and get through a rather murderous circumstance being a surgical resident. And so that's how I know stress can affect what we call the TMJ area, the muscles of the jaw that regulate the joint here under the ear, the temporal mandibular joint. And people who have suffered from it will know they have pain right there under their ear. Another real common area are stress-related injuries and pain in the shoulder complex. There's a muscle here called the trapezius, which is a real broad muscle across the shoulders. It's very commonly involved in this process. There's some interesting studies out there that people who type, and it's not so much the typing, it's what they're looking at, the type of information they have to deal with while they're busy with their computers, coupled with the posturing, and Dr. Joe's going to chat with us about that. But that combination of big, heavy visual load stimulates the sympathetic nervous system, and in particular the muscles of the upper back and lower neck, very much vulnerable to stress responses. And just an aside, I don't know if we'll get to it, but we actually see an interesting subgroup of people, and they have chronic pelvic pain. It hurts to sit, and it turns out the muscles of the pelvic floor are also very vulnerable to stress responses from the sympathetic nervous system. So that's sort of it in a big opening salvo.
Just a brief overview, if you guys are just tuning in, it's Sarah from Primary Bodyworks with Dr. Tyner and Dr. Joe. Dr. Joe is joining us from Physical Therapy to You, and he is going to start talking to you about posturing, how stress relates, how we hold ourselves, and how it can cause pain.
So I appreciate your time. So one of the biggest things I bring in is a face cradle, because I have so many people, they sleep, they're stomach sleepers, and they turn their neck to the side or to the side, and it puts a huge amount of stress on the neck. So one of the keys is a face cradle. It doesn't have to be like this in particular, but you can Google, it's called prone pillow or face pillow, and again, this is attached to my massage table, but if you take this off and just kind of sleep in more of a neutral position, obviously my neck's not neutral here, that'll save you if you're a stomach sleeper. I want to be a stomach sleeper. I haven't in years, partly because my back used to bother me. I'm over that, but I haven't solved the riddle, what you just said, so I feel kind of dumb I had to come to this thing to figure that out.
No, it's simple. I mean, they don't make as many prone pillows as I would like, because I don't think there's a big market for them, but I tell patients and then we'll get to posture ergonomics sitting in 1 second, but this is for the last 2 weeks, for some reason, I've had 24 patients that are stomach sleepers, and they keep asking me why their neck hurts. And I said, well, would you do this for 7 hours standing? And they said, no. And I said, well, that's what you're doing when you're sleeping. So
Yeah.
no kidding, your neck hurts, right? Or your shoulders hurt. So
Right.
like I said, prone pillow, or the real cheap way is you just take a towel, make an upside down U, and have your head obviously so you can breathe more of a neutral position, because if you put your head to the right or to the left for 6, 7, 8 hours, even if you don't have neck pain, you're gonna have neck
Right.
pain. So that's what I wanted to start out with. Most people, I don't know most, a lot of people are not stomach sleepers, so I'll just talk about general ergonomics. Everybody that's working from home and people
So
that...
let me,
Yeah.
if you don't mind. So you're talking about ergonomics,
Right.
and so there's this term that I've run into. What is it? Face or so head forward position.
Forward head, FHP,
Forward head.
forward
Yeah.
head posture.
So it's a big part of this, of loading.
Right.
So just to kind of circle back a little bit, what's been your experience in forward head positioning and stress, how they feed together?
Okay, definitely huge, because everybody, I'd say 97% of the people that work from home or work in an office, they're sitting, and let's say you're the screen, they're leaning forward, and no one is watching proper ergonomics. And I believe, don't quote me because someone's going to look it up, but I believe that every inch forward of the cervical spine adds, I think I want to say 5 to 7 pounds extra on your cervical spine. So if someone's 2 to 3 inches more forward, the amount of stress on the joint is 5, 10, 15 more pounds. And then, as you spoke about before, the upper trap, which are these guys, and the levator muscle, which is from the shoulder blade up to the cervical spine, they all get super stressed, and they wind up going into spasm, and then you wind up having trigger points. And then it's this vicious cycle of poor posture, stress.
So related to that, I'm just curious how you relate the issue of chronic contraction of a muscle, which is what you end up with.
Right. So, I mean, chronic contraction is just the repetitive poor posture and repetitive, I guess, workplace injury, we call it, or poor ergonomics. That if you're repetitively staring at the screen, your arms are high because your keyboard and mouse are not at the proper positions, which I'll talk to you about in 2 seconds. Just 7, 8, 9. I have one patient, he's 10 to 12 hours a day in meetings on Zoom and whatever, and think about 10 to 12 hours just in a really crummy posture. Everything, C-spine, extensors, upper trap, levator, they all just wind up going into spasm, and they stay there until that cycle's broken.
I will say we see it regularly, but just to say, so and I guess in your view, there is this constant contraction, but I just kind of want to beat on the stress part of it. Have you been able to interpret from the patient that stress augmented, aggravated what they were doing?
I think it's kind of a vicious cycle. If someone's stressed, they're not paying attention to their posture, then they go into poor posture, then they go into muscle spasms, then stress from work, home, etc. makes the muscles even more tight. I would say 9, this is Dr. Joe's study, it's not an official national study, but I would say 8 to 9, let's say 90% of patients hold their stress in their neck and upper shoulders. So it's this. So even patients that don't work all day from home, if they're stressed, wind up getting a lot of chronic headaches or just neck and shoulder pain because of poor posture. And I think when people are stressed, they just kind of tense up. So yes,
That's my go-to move right there.
tense up.
That's my shoulders keep coming up.
Yeah.
Yeah.
That's.
Well, I just read something related to TMJ problems, which not specific to back of the neck, but 80% plus of TMJ patients have with it an increased state of anxiety, which obviously is a stress response. So a super high number of people who suffer from TMJ problems have, coupled with that, stress, anxiety, potential disorder, or at least incompletely dealt with stress.
I mean, that makes sense because I think we were going to talk about it later, but we'll talk about it now, is that someone's real stressed out. You probably have a lot of patients, or at least I do, when they're stressed, they kind of clench their teeth, not even sleeping, just, I'm on a meeting or just driving, and you're super stressed, and their neck and shoulder, but then people don't realize that their jaw is kind of clenched, and that contributes to stretch, because the masseter is one of the most powerful muscles in the jaw, main muscle for chewing or mastication. And if that's stressed, that can either cause jaw pain, TMJ pain, or it can refer pain to the head, and you get these kind of chronic headaches.
Right. I didn't want to steal your thunder about
No,
ergonomics.
there's no thunder here. You can. Everybody's got thunder. So.
All right. So we have spine here. Is that what that is?
Yeah, I mean, this is just basically, just the normal. You've got your cervical spine, so the head's here. I decapitated this patient this morning. The cervical spine has a little bit of a curvature, and then the thoracic spine has more of a kyphosis. So this is more of a little bit of a kyphosis. If you're side view. Yeah, and then so the lumbar spine has a lordosis. The thoracic spine, which is kind of the mid spine, has a kyphosis, which means the spine's coming more forward. And in theory, the cervical spine has a little bit of forward, but what happens over time structurally is it gets more and more bent. I have a lot of patients that are, let's say 70 plus, but arguably 40 plus, that have crummy posture, and this thoracic spine, I just cheat and use you right here. This thoracic spine over time kind of gets rounded, and then what happens is, although the muscles get tight, this starts to become structurally changed, that the bone actually becomes more in this kyphosis or rounded, and that we could change the muscular, but over time, normal aging will have more of this kind of C position in the thoracic spine, but if you are in crummy posture all day, it'll expedite this bad kyphosis, and then
it becomes permanent.
It does, yeah. Not overnight, so I don't want people to freak out, but over time, if you're not aware of the posture, the bony structures wind up becoming permanent.
I feel like as soon as that came out, we all sat up a little straighter.
Yeah.
It's not me. I don't do that.
So yeah.
Can you tell us about, because I actually took what you said to heart, and I got this.
Okay.
So it was $20
that's
on our
laptop
favorite
stand?
place. Yeah. And it just pops, and this goes down, and it brings my laptop up incredibly high.
Yep.
But now I'm
Yep.
right where you want me to be.
Yeah, so I usually say, so you can get a laptop stand for $15-20 on Amazon or wherever else, and I tell patients, especially ones that work from home or the office, but the best, they used to say $20, but things have come down. The best $10, $15 you can spend is you put the laptop on a stand and you don't use it as anything else except the TV monitor. In other words, you don't type from it. Then for this is where the $10 comes in, or maybe another $10. So it might be $10 for the stand and then another $10. The other $10 is a wireless keyboard and mouse. And what you do is you don't even put the keyboard at desk height. You actually put it on your lap or use a cutting board or tray, and you keep that low. And the mouse stays low whether you're right or left-handed, and then the top of the monitor where the camera is, you raise your tray or your platform so that the top of the monitor is at eye level, so that watch my neck and shoulders. If you're typing low, but look, let's say Dr. Tyner's top of the head, he's the top of the monitor. Now if I'm typing low versus if my hands are up here and I'm leaning forward, there's such a huge difference rather than sitting up nice and tall and keeping the key. A lot of people, they know about the monitor being at eye level, especially the top, but a lot of them say, oh, well, I use it at desktop at the height of the desk, but if the mouse or the keyboard is too high, the upper trap shoulders immediately go up. So if you have the right height for the laptop, but your shoulders are up, you're only kind of doing 50%. I'd argue you're losing more than 50% because your shoulders go up. So it's gotta kind of be both. But the good news is it's so easy and cheap to do.
So I've got the 50%. I'm going to invest and get the other 50.
Yeah,
I'll get the
wireless keyboard and mouse is $10-15 at the most, and like
Okay.
I said, just keep it low, and then like I said, want to raise that a little bit higher.
Yeah, I
just
mean,
to-
I usually have it higher.
Yeah,
I just
yeah.
didn't have time to
No,
make
no,
my
I'm just-
adjustments alive.
I'm just FYI.
Yeah, this is kind of where I am.
But if
actually.
people want to be really cheap, just throw this in there, is if you're over 30, which only I am because Dr. Tyner and Sarah are 20, but if you're over 30, you remember what phone books are. You can actually use old phone books or dictionaries and be really cheap and don't even have to spend the $10 for a laptop, height adjuster. But that's just another way.
Food for thought.
Yeah. All right. You go ahead. I don't know. We've got a plan. I've got some questions for you. So.
Well, I do have plans. Are you good on the tips and tricks for posturing?
Yeah. Do you want
Yeah?
me to?
Well, I was just going to say
I
that.
want to add something. I'm curious for you, since we're talking about 7 hours of sleep and X number of hours at a computer, and again related to stress, both structural posturing related, but also visual stress and potentially just external environmental stress. Do you advise people to 45 minutes? You shut the world down, you go and do some shoulder exercises?
Yes, that's a good question. So the typical patient that's on, when I say Zoom, it could be Zoom equivalent, but everybody that's not a construction worker or a physician is usually at a computer all day or a good chunk of the day. I have a gentleman now, I believe he's a mutual patient of ours. He's on the computer for 10 to 12 hours a day, and he has rock hard psoas muscles, which are in his hip flexors, and he's got super tight pecs, which is the chest muscles, and super tight upper trap levator, which we just talked about. And it's because he finally fixed his computer, but sitting for 10, 12 hours a day, even if you're not in a meeting, is just awful for the back, neck, shoulders. So what I recommend is set a timer, or like on your phone or on your computer, I'd say at minimum 60 minutes, but if you could do every 30 to 45 minutes, just get up and stretch. I'll show you 1 or 2 quick stretches, but even if you do nothing other than just stand up and walk around your office or room for 2 minutes, the hip flexors get a relief, the upper trap levator gets a relief, the lumbar spine gets a relief. And if that's the minimum you can do, 10 to 12 hours in a 10 to 12 hour day, that's bare minimum, because at least you're decompressing all the joints. If you've got another 2 to 3 minutes, there's a few favorites. One, because everyone's chest is super tight because they're doing crummy posture, you could do a pec stretch, and that involves, you can go into the corner, you can go into any doorway or the corner of a wall, and you can put one hand each above 6 inches above your head, and then you just lean forward, and you'll feel a big stretch in your chest. That will take pressure off the neck because it'll pull your head back, and it'll take pressure off the shoulders because it'll pull the shoulders back. So that's a good one for 30 seconds to a minute, and you can repeat that 3 or 4 times. The other two, there's 20 I can give, but my other 2 favorites are upper trap, and I call one ear to shoulder, and I call the other one nose to pocket. So ear to shoulder is you hook your arm underneath the chair, you lock it under, and then your head is on top of your opposite hand goes on top of your head, and you pull your ear to your opposite shoulder while using your right or left hand as an anchor, and that's a good one. Same thing, 30 seconds to 60 second stretch, and then you repeat opposite side. The other one that's real similar is and that's for this trapezius muscle that kind of sits from the exactly, there you go. It sits right here as Dr. Tyner's choking me. No, I'm joking. So it sits kind of on the side. The levator is that's right, as he's beating me. It's like the award ceremony again, right? The levator muscle goes from the back of this scapular or shoulder blade to the cervical spine. They kind of overlap, but a little bit different. Instead of going ear to shoulder, you actually do, I call it nose to pocket. So assume that you have a pocket, and instead of going ear to shoulder, you're still locking under, but you can pull your nose to your opposite pocket. You can even take this hand and bring it a little bit behind you and kind of pull your shoulder blade down. And those two, in addition to the chest stretch, those are the big 3 that will keep you out of this kind of chronic poor posture, in addition to getting up every hour and in addition to the proper workstation ergonomics. One last thing that I had forgotten, because we're talking mostly about lower body is just as important. There's two main muscles in the hip flexors that are called the iliacus. I'll show you on the little skeleton here. The iliacus sits on the pelvic wall, and it's a hip flexor. And then the psoas, which is its next door neighbor, attaches from the transverse process of the lumbar spine into the femur, and they both do hip flexion. The problem is for anybody, but for tall people, but anyone in particular, you always want to make sure that when you're sitting, your knee is lower than your hip. So if you have an adjustable chair, try to bring it up, because if your knee is at the same height as the hip, or arguably even higher, if you're in a really low or deep chair, it puts a tremendous amount of pressure on your lumbar spine, but it tightens or shortens these hip flexors. And like I said before, one of the main hip flexors, the psoas, attaches into the lumbar spine, and if that gets tight, it'll actually pull on the lumbar spine, and people will get back pain. They'll say, "Oh, like I have back pain," and I'll do a psoas release, and their back muscles are not in spasm, but the hip flexor muscles are, because they're sitting with such a knee-high position, and these transverse processes attached to the lumbar spine are getting yanked on, and they're getting pulled. So posture sitting, including keeping the knees low, is key to actually keeping the back from hurting.
So I think all those posturing things are great. I want to bring up one little thing, and I learned it in bariatric surgery, and I eventually learned it for myself. And one of the things I told my patients all along is, you need to understand the world doesn't care about you, and that whenever you die or whatever, the world's going to still spin. So somewhere in this game, you have to take care of yourself. And we're talking about stress and how to protect yourself. Part of it's postural, but somewhere in there, patients have to know, wait, I've got to take a few minutes for myself.
Yeah.
And if that includes going up and doing the stretching that he mentioned, I like hanging, believe it or not, partial weight bearing, hanging from a door frame. It helps back here, it gets my head back and all these other things. But I think one of the keys in all this is to remember to help yourself. And I, as a surgeon, spent 30 years taking care of everybody else except myself. And when I was a resident, I didn't even know I had a self. I was working so much, and that's part of how my jaw became so affected. But I think somewhere, and I tell the patients that we see, okay, listen, somewhere in there, you've got to take time to do some stretches, to do some strengthening things, and it's your job to take care of you. And in reality, for the most part, the rest of the world doesn't care. So just as an aside, since we're kind of dealing with stress and how it shows up in muscular pain, just remember, when you're working for 10 hours at a computer, there's probably someone who will take your job. I'm not telling you can't do your work, but you owe yourself something. And I'm always stressing to patients, you've got to take care of yourself. So.
Yeah, that's a very good point. And I did want to mention that, just a very brief, if anyone's just tuning in, I am Sarah from Primary Bodyworks. This is Dr. Tyner from Primary Bodyworks. He's the Chief Medical Officer. Dr. Joe here is from Physical Therapy to You. And tonight we are actually discussing stress and how it affects with myofascial pain. Not where we're going, right? We're kind of getting there, but we got a little sidetracked for a second. You want to jump back on and talk about how Primary Bodyworks can help with the myofascial pain?
Yeah. So first of all, we started our activities here, business, I'd say, about 2 years ago, and we got introduced to the principle of acoustic wave therapy, which is basically a device that generates pressure waves that we can in turn focus into a relatively small area at various depths, from just under the skin to several centimeters deep into the tissue. So we can aim these pressure waves into muscles. And in terms of this environment, if we're talking about a muscle just under the skin of your face here, we don't need to go particularly deep. If we're talking about your trapezius muscles, muscle up here in the shoulder area, again, we don't need to get very deep. If we're talking about some of the muscles of the buttocks, we got to go deeper. So anyway, we have the ability to focus pressure waves into muscle. And the question is, so what? What's that mean? As it turns out, the body is adept at using pressure waves as a cue for several things to happen in the tissues. So in muscles in particular, if you put pressure waves in a muscle that are, I'd say, attuned to what they're capable of tolerating, you don't overdo these pressure waves. One of the first responses happen in muscle is what we call vasodilation. The capillaries and the arteries in the muscle bed will open up. And one of the problems with a issue of triggers and the pain associated with it is a situation where there's not enough oxygen, there's constriction of the vasculature. So if you can reverse that hypoperfusion, not enough blood flow, by causing this vasodilation, that's the beginning of reversing muscle spasms, all right? In addition to that, an interesting side note is that pressure waves have this unique property of causing a depletion of some of the neurotransmitters that are associated with pain. It causes them to be dispersed into the tissues as opposed to being in the nerve itself. And from that, you can create a certain amount of analgesia in the tissues from pressure waves when they're delivered at the appropriate dose in a way that the patient can tolerate it. So that's the first thing we learned in doing this. So in treating people with bad backs, whatever, so we found it could be very helpful. In terms of scenarios where patients have stress-related myofascial pain, we've been very effective in managing patients with TMJ pain, and obviously we see a lot of patients with shoulder issues and such. But the idea is that we're putting pressure waves into tissues, and the body's response is improved perfusion of the musculature and suppression of hyperirritable nerves. That's it in a real short order. And in fact, patients can appreciate that in as few as 15 minutes. We don't necessarily get every trigger out of every muscle in 15 minutes, but we get a large percentage. So I'd say our batting average is probably about 50 or 60% of the triggers that are associated with pain can be reversed in a single session. And if in the setting of TMJ, what we've seen is by treating the masseter muscle, as mentioned here, sometimes the muscles right immediately adjacent to the joint, the pterygoid muscles, and sometimes the muscles right above that, the temporalis muscles. Within 3 or 4 of these things, we have a large percentage of our patients find that their TMJ pain resolves. And a similar sort of phenomenon happens in the muscles of the neck. And as Dr. Joe was saying, there's really a series of muscles that get dragged into this. And we're fortunate that the technology used gives us the ability to identify the triggers, because the patient tells us, "You found it, doc." And then we focus on that area for a few minutes. We start getting that response. Patients notice that the area is less and less irritable. So that's it in a nutshell.
Thank you, doctors. I think now we're gonna give you guys some time to...
Well, I don't know where that's going, but so if someone came to you with TMJ pain, what would you do and what would you tell them to do on their own?
So a good chunk of time with TMJ pain.
No, I'll tell you what was told me. Yeah. You're gonna need surgery, boy. So
I don't usually, well, first of all, I don't do surgery, and you don't want me doing surgery. My kids will tell you I'm very good cutting strawberries. That's about it. But anyway, I would say from my 20 years of experience, I don't really remember any of them really having to go for surgery, unless they had some major jaw dysfunction that they were born with. But 90% of the time, the joint doesn't really have to be mobilized. It's the masseter that's overused. It's either they're super stressed with clenching the teeth, and they're stressed with their upper trap levator, and everything's stressed. So the key is I get them to try to relax, relax the jaw. And there's a couple exercises I can have them work on throughout the day, just kind of dropping the jaw. You can kind of click the top of your, the tongue can kind of click the top of the palate. And that kind of just resets it. Doesn't guarantee it's going to stay there.
Just popped.
Yeah, I mean, so, it doesn't always get a pop, but clicking the top just relaxes everything, or at least makes you more aware of it. But if someone has either chronic TMJ pain or these chronic temporalis headaches, I don't want to say 100%, but about 90% of the time, if I glove up and I do soft tissue work, both on the outside and then on the inside of the masseter muscle, it can be very tender because there's a lot of trigger points in there. These are the main muscles for eating. So they get used often, but they get used even more often if you're clenching. And I would say if we can get the masseter muscles softer or less trigger point and less in spasm, most of the time, again, 9 out of 10 times, the TMJ pain and or the temporalis headache pain will either subside or terminate. So, yeah.
All right.
So I'm just going to kind of open the floor up to the questions.
All right. I got one more though.
Well, these are your questions?
Yeah.
All right.
Okay, well, no, I'm kind of enjoying it. Let me just say this.
All right.
We have a physical therapist here. I don't do physical therapy.
No.
I used to teach physical therapists anatomy. So
You did?
Yeah. So that was, I did that for fun in my summer job. In
For
medical
fun,
school.
Dr. Tyner says.
Well,
That's
it
how
was
he
fun.
relaxes.
They were all women, so it was great. But anyway, no Dr. Joe's there. But anyway, so if somebody, now I'm really off from that. No, so headaches is a part of this. You mentioned that temporalis, or I'm sorry, I don't know if it was temporalis.
Temporalis.
Yeah. So the other day we were treating some gal. She says she's chronic headaches, and it's all her triggers were back here.
So C-spine extensors, yeah.
Right. So same thing.
Yeah.
So you're gonna get them to do some exercises to relax their jaw. You're gonna do some manipulation. They come in with tension headaches, right? Which is kind of in the same ballpark, stress related, forward head position. What are you gonna tell somebody for tension headaches?
So the headaches can be both. It can be masseter, which is more temporalis. If it's more occipital, and the head sits on the occiput and or the occiput's kind of the bottom of the skull, and then it sits on C1. There's a lot of times these cervical extensors that go into the back of the head.
Thoracic extension.
Exactly, yeah. The occiput, believe it or not, that could be out of alignment. It's very subtle. We're talking about millimeters to maybe a centimeter. I can mobilize the occiput because the occiput, if it's not sitting on, it's like a building structure. If the head or the occiput's not sitting nicely on C1, which is the first cervical vertebrae, the occiput, although it doesn't have a lot of motion, will have enough that if it's off by a centimeter or probably less, will cause headaches. So I'll either mobilize once I figure out what position. It's usually stuck either forward, side, back, and that's me doing some PT assessment. Once I figure out which way they're stuck, I'll mobilize the occiput on C1. That'll free up the occipital movement. And then C1, which is the main rotation for, a good chunk of the cervical spine rotates, but C1 is they say 50%, or depending on which literature study, but a good chunk of the literature says C1, which is right below the occiput. That does a huge amount of rotation, and if that's stuck and it's not sitting well on the occiput, that needs to be mobilized.
Stuck because of the adjoining muscles?
It could be stuck usually because of the facet joint. There's little facet joints on the side. They could just be stuck. A good chunk of time it's muscular. So I usually have to clear out and do soft tissue work. But once I do soft tissue work, it doesn't magically, you'll get more motion, but I have to, the joint, let's say it was stuck to the left and it's been 6 months, even if I clear out the soft tissue, it's just not going to magically move left and right. Then I'll have to actually get in there and mobilize it either left or right or both. So
I'll just kind of throw in what we think we're capable of. The energy we use is very good at releasing the triggers. I wouldn't even know that an occiput is responsible for 50% of the rotation of the neck. So I sure as heck wouldn't try manipulating it. So one of the things that we are enjoying here is the ability to help patients, but understand that we have part of the answer. That's why we're enjoying our relationship with Dr. Joe and other physical therapists, because part of our deal is get somebody out of pain and then try to help direct them in way that they can continue to make progress either by stretching and strengthening and or potential manipulations. So
I think that's key, because like I always tell patients, like if you're in chronic, even if you're in acute pain, which means a short amount of pain, but if you're in chronic pain and like I try to do soft tissue mobilization, or a layman's term massage, but it's a little bit more in depth with PT and or manipulation. But if you're in either too much spasm or you're in too much pain, one of two things will happen. A, you won't tolerate the treatment at all, or B, you'll tolerate it, but then everything will just kind of come back. So I definitely agree with you that the pain, whether it's pain medication, which I'm not as big of a fan of, and obviously you guys are not because you do this, and or sound therapy, if it can get the pain to a tolerable level, and then I can get in there and do soft tissue or mobilization, and the patient will tolerate it a million times more.
All right. It's great. I'm learning so much. Really.
that's why we got the pro.
I've had treatment from both of you
I
guys.
just play a PT on TV.
We do have some questions coming in, and I do actually have some that were emailed previously, so I want to make sure we have time to get to everything.
Sure.
And actually, I have an anagram that I learned years ago, and it kind of applies. You want to hear it?
Let it roll. It's your meeting.
All right, it's my meeting. So the anagram is actually the word stress. And I've learned it years ago and remember it today. But the first S is for sleep. Everyone should be getting 7 to 8 hours a night, right? If you can get it. Some people can't.
Sleep is huge.
Yeah.
Because just finding it going through your anagram, but I agree, because like, I would say there's a huge correlation between not getting enough sleep and stress and immune system, because like from a ton of studies I've read and then just practicing PT, that in general, when patients don't get enough sleep, they're run down, then they're stressed, then they get a cold or worse, and then it's just kind of this vicious cycle. So
right.
sleep is kind of underrated. Not to me, I love to sleep, I don't get enough probably, but sleep is so key to stress and the immune system.
Well, S is sleep. T is for talk it out. So that can be with a partner, a friend, a specialist. Sometimes I talk to myself. It all helps. Just get it out, right? R is for rest and relaxation. And this varies wildly, because I'm sure what you guys find relaxing isn't the same as what I could find relaxing. Like, you like golf, right?
I will go to the driving range.
Yeah, that would make me crazy. I have to have it perfect. The E is for exercise and eat healthy. I do struggle with this from time to time. I know we've had that talk about sugar and how sugar makes me happy, mainly cake, but just getting started, even just walking, right? Just get started somehow. That S is for sense of control. And I know, Dr. Tyner, you kind of mentioned this, but being able to say no. Like, I think what my grandmother used to say, you can't get water from an empty well. So being able to prioritize yourself and take care of yourself and worry about others after. And that
So
last...
let me just say, I saw that so often in bariatric surgery.
Yeah.
And half my time wasn't spent talking about surgery. It was talking about, why are you doing that with your kids? Or why are you not getting your brother and sister to help you with your mother?
Right.
It's like, right? I spent so much time in that arena. And I'm not perfect. I learned about this myself as I work through life. But just the same, very, very important in terms of it ultimately leads to a stress response in a lot of ways.
Right, exactly. Okay, so that very last S, it's for what we're saying is shaking the sheets. Producing those feel-good hormones. And this activity, again, can be done alone or with another person.
There you go.
So that's my stress anagram.
It's oxytocin, by the way.
Oxytocin.
Right.
I say feel good for hormones, but that's why I don't make the big bucks. So on to some of our questions. These are actually emailed previously.
Let me just say the other thing. It's not only oxytocin. You need a parasympathetic nervous system, which is the opposite of a sympathetic nervous system, to complete shaking the sheets. So it's the antithesis of a stress response.
Well, the stress responses varies because you said fight or flight, but I know for a fact I'm freeze.
What?
I freeze.
That's, well...
I don't fight or flight.
What is that? Goats that freeze and fall over?
That's me. I'm a fainting goat. That's what I
headlights.
do. Deer in the headlights. Yeah, that's me.
Okay, well...
Just don't move.
It's fine as
No,
long as
no.
a freight train's not coming your way.
Okay, so our first question here is, and I think one of my coworkers actually wrote this one, but why do I get a headache after work so often?
Well, I think Dr. Joe has alluded to that to some degree, postural issues. I'll let you, if you want to follow up on that.
Yeah, I mean, just goes back to, a good chunk is posture. Yeah, I mean, if you're like 8, 9, 10 hours with the crummy posture, forward head, all the cervical extensors are going to get stretched out, and then they're not, every muscle works at an optimal position or angle, and they're not working at optimal positions or angles, and they're going to wind up going into spasm. So
there is related to that this thing called referred pain. So as it turns out, muscles, the trapezius, you sense pain potentially up in front of your eyeballs, even though it's a muscle right here. We have a lot of patients come in and say they have headaches, and the triggers we find are actually in this muscle here called a supraspinatus. It's out in heading to the arm. So those are all issues, and then I'd say going backwards, this idea of visual stress and such can activate the trapezius muscle, and it's called the great mimicker for headaches. So all these muscles back here can have what's called referred pain to regions of the head. They can be linked, I'd say.
Well, another one that's huge, and I want to say some studies have said it's the biggest trigger point muscle, or has the most potential for trigger points, is this SCM, which is the sternocleidomastoid. And it goes from the mastoid process and behind the ear, and it goes all the way into the clavicle in the front. And they help turn the head, and they hold up the head. But when someone has forward head posture, they get elongated and they go into spasm, and that's another one that can be very tight and very spasmy or trigger points, and that because it goes into the occiput or into the mastoid, which is next door neighbor's occiput. A lot of people can get headaches if the SCM muscle is in spasm. Mm-hmm. Again, posture.
All right, so this next one here is, well, I think we're dancing all around this, but can stress make pain worse? Is it proven?
Yes, it's proven.
Yes,
Because what we said before, because the sympathetic nervous system is important in setting a muscle up for activity. And if you're constantly using A, the muscle, and B, adding stress into it, it just potentiates that desire for the muscle to get tighter, and then comes the pain. So.
Yeah, I mean, stress, I've seen patients over the years that, let's say they hurt their back 5 years ago and they haven't had any severe, let's say it's either post-surgery or even just kind of 5 years ago, they just lifted and hurt their back and everything was quiet, but they'll say, I'm having family stress or I'm having workplace stress or whatever, and magically their back pain comes back without doing a lift or a fall or a twist or a turn. So I do see it often that not all the time is the site of the injury caused by a mechanical issue. Originally it may have been, but a lot of times my patients will either get new back pain or neck pain or shoulder pain, or an old injury kind of sheds light or kind of peeks through and comes about if they're stressed out.
Right.
And comes on pretty quickly and stays on until the stress is off.
I'm going to throw a real curveball at you, but just curious. What's been your take on people drinking caffeine and these sort of things? Or have you linked the two?
Yeah.
We've seen, so in pelvic pain, which
Right.
is again a potentially a stress thing, I've seen this interesting link between heavy use of caffeine and potentiation of pelvic pain.
Yeah. I know.
And by the way, caffeine is an additive in terms of the catecholamine effect or sympathetic nervous system.
Yeah, I know that some patients have like an increased, if they're stressed, but then even with more caffeine, they'll have an increased heart rate. Sometimes I've heard, not often because I don't do a lot of pelvic PT, but I've heard that like a man or a woman will get, like if they have a history of prostatitis or BPH and it's relatively under control, but then they drink a lot of caffeine, it kind of, the pubic muscles or the coxogenial muscles, they'll get tighter and they can cause more, stress.
About like this sort of thing.
Yeah, I mean, I haven't seen a ton of correlation, but I have patients that when they're under caffeine, they can have more headache and neck ache. The one I see often, and it's a lot of my medication.
All right, so let's try this again. I don't necessarily see why we would have lost.
Well, maybe we should stop anyways.
Maybe we should stop talking. That's our cue to stop. Dr. Tyner, you just finished on a stretching good for stress. I really wanted you to touch on that gluteus medius because there is a game going on at home. And then let's just briefly talk about some healthy ways to alleviate stress. I kind of want to make sure we touch on everyone before we end, but healthy ways for me to alleviate stress. I like walking, and I have a little dog. We're hoping you'll see her soon. She has Primary Body Works clothes that she wears out in public.
Nice.
So she is our mascot. But what other alleviations could we use?
Yeah, I mean, well, any type of exercise, I'm a big fan of, obviously, whether it's weightlifting properly, and that's a whole different conversation, swimming, walking, jogging, those are all, I tell patients, at least 3 times a week, but at least daily if you can get out. I know when I come home, and now that the days are getting longer, just in my neighborhood, I'll go for a half-hour walk. It's kind of in the woods, and it's just quiet, and I'll just do that before I have to go back on the computer and type patient notes, and also just some sort of way to kind of disassociate from the daily life. That doesn't mean shut everything off, but just kind of get away from your daily routine. I think it is definitely healthy to do every day, to be honest, just kind of get you away from just the craziness of the day.
All right, we're almost through for this evening, but I just actually wanted to touch on here. So, Dr. Joe, this one is specific for you.
Sure.
How often should I be getting an adjustment?
So that's an interesting one. So like everything else in life, it depends, right? So, but I'll get into a little bit more specific. So I've had patients over the years kind of ask me that, and I feel as a PT, I try to make a patient independent. So that doesn't mean I don't want to help them. That means that if they're out of alignment, I will put them back in alignment, but then I'll give them A, B, and C, usually 1 or 2 exercises, maybe 3 for a home program, to do a stretch and to do a strengthening exercises to keep that alignment. I don't have a set number. What I don't like is that there are certain professions, my profession sometimes, other providers, and certain chiropractors, not all, that will just kind of sign you up for a package deal, and they'll say, well, twice a week for 6 months. And the reason I'm against that is, let's say after 2 to 3 weeks, you don't need the adjustments anymore, but you still got 5 months in your package deal. So then you feel obligated to get adjusted. And I tell patients, it's rhetorical. Would you put WD-40 on a door that doesn't need it? Like, it's not really necessary, and it may be, especially if it's the lumbar spine or the cervical spine, maybe overkill, meaning that not really dangerous, but why mobilize a joint that doesn't need it? You're just putting a lot of pressure on the vertebrae and the surrounding tissue. Not dangerous, because I do it all the time, but I'm just saying it's just not needed. Once the alignment is back into place, the posture is good, the strength is good, and the stretching is in place for proper ergonomics, it's not needed. Now, that being said, I always tell patients they know their body better than I do, and that's the truth. And if they say, hey, after 2 or 3 mobilizations, and then I had 2 to 3 weeks that was quiet, I turned the wrong way, or I think I slept the wrong way, or I have no way of knowing, sometimes there's no mechanism of injury, but I'm not back to square one, but something doesn't feel right, and I tried the stretches and strengthening, and I'm still 80% better, but I'm not 100%. Then I say, come in, and there's 9 out of 10 chance, if not 10 out of 10, that something is slightly out of alignment. So I usually do a few times on average. It just depends. Some patients it could be 1, some patients could be 2 to 3, some patients could be more. I don't want to say an exact number, but I just don't like the fact that it's not necessary to constantly mobilize the joints, including the shoulder or hip. If the motion is normal and the strength is normal, there's no reason to do it. So again, it just depends, but it's a combination of kind of my findings and kind of how you're feeling.
Okay. I think that's a great answer, right? Just kind of listen to your body. And to wrap that up, I think tonight, when we touched on stress, we kind of looked at it as a whole picture, right? One of the things that we want to stress is putting your health first.
Emphasize.
Well, I said stress.
You can stress.
We want to stress
it's
stress.
It's like stress squared.
That's exactly what I was going for. Thanks for picking that up.
It's the only thing I picked up all day.
That's the only thing we have learned here tonight.
I was raised with a thesaurus. I couldn't do that.
I was just reiterating the word, but what we want you to all take away from this is value your health. right? We have resources here. So we have Dr. Tyner. You can come use acoustic wave therapy. We have Dr. Joe. You can go and get some physical therapy, which she's brilliant at, like I attest to.
I paid her a lot of money to say that.
And not represented here, but I do want to give a personal shout out to Brenda Hill from Hilltop Massage. She has treated a lot of people.
She's treated me. She didn't ask me to say so, but she's excellent. She's probably one of two, now one of one, of pretty much the only massage therapist I recommend in the RTP area. And I'm not saying that she doesn't pay me. They don't pay me. I'm unbought, and I say it.
Yeah, amazing. So plenty of resources out there. Come see us. Go see Brenda, whoever it is. But feel better. Don't live in pain. And tune in for the next Talks with Tyner. Who knows what we'll be doing? Right?